Hello friends, I made this video to demonstrate how to use one of the phosphorus plate systems called as VistaScan from DER Dental. Talking about the sensors, the part of the system which I like the most, sensors. Mostly available and most commonly used are the two sizes 0 and 2. They comprise of two parts. One is this hygiene bag and other one is a very thin sensor. When you use it into the patient, you have to remove this adhesive layer, pack it, shoot it, and then put it into the scanner. As you can see, there are two sides of each sensor. One is the printed, another is the plain blue. This printed, as it is clearly written back, so the other side is the tube facing side of the sensor. So when you shoot the X-rays, the X-ray should fall first on this surface. If you see, there is also a small dot. Yes, there is a small dot here which can be used for the similar functions which you use it for your regular intraoral X-ray films. Talking about the flexibility, being a pediatric dentist, why I like this system is because of the flexibility of these sensors. See how flexible these sensors are. You really can't afford pushing or poking that thick any intraoral RVG scanner into a 2-year-old mouth, and here where the X-ray part is made comfortable for a toddler or a preschooler. Talking about the scanner, first let me talk the thing which I don't like about this system is changing these lids. You have to frequently shift or shunt between your sizes of 0 number film and a 2 number film, and if you can see closely, this is a 0 number lid for the scanner, and then there is another one which is a 2 number lid. You can't put a 0 number size in here and you can't put a 2 size in here. So if I have to make a adult size X-ray, I'll have to remove by pushing this with my thumb and taking it out and putting the 2 number lid back. Talking about switching on or switching off the scanner, to switch it on, it requires a small press, and then you have to wait for some time for this green light to lit. Once the green light is lit, means the scanner is ready to take your sensors. See, the sensor is getting ready, and once this red light goes off, you can start pushing your sensors. Talking about how to switch off this, for switching it off, it requires a longer press. These blue and green lights lit alternatively, and finally the scanner stops like this. Talking about the software, this is the icon of the VistaScan called as DBS WIN. Once I double click on this, the software opens. Once the software window has opened, if you see this plus mark, this is used to create a record for a new patient. I'll click on this, put first name, put surname, and other details if you want, like title, date of birth. Date of birth is, I think, mandatory in this. for easy identification, and then you press this save the record in the database icon. Once you have done this, now you have two icons, X-ray and the viewer. You press on this X-ray button, select the tooth for which you want to scan the X-ray, or you have shot the X-ray, and put input. Before selecting the input icon, one additional feature again which I like about VistaSense software is you can select the quality image as well. As you can see, there are option of 500 dpi, 1000 dpi, 1270 dpi, 2000 dpi, whichever mode you like the most, you can use it. But remember, the higher the resolution you choose, slower the scanning will take place. So for my regular patients, I always choose the 1000 dpi or 20 lines per mm mode. I'll press the input, and now this scanning or imaging window has opened. Remember, I can select my resolution here as well. Now once I have selected the mode, I have selected the tooth, it's time to put the sensor into the scanner. I'll remove it from the bag and I'll put it into the sensor. Remember, the size of the lid and sensor should match. As I have selected a 1000 dpi mode, it's going to take longer than a 500 dpi mode, and then we'll scan a X-ray, and eventually once the scanning is done, once the reading the data is over, you can close the window, the sensor falls down safely here, and you can do all the necessary changes in this tooth. Once you are done with doing all the changes, you can change the brightness, grayscale, etc. You save this X-ray, and once you want to go back and see this, you can open the viewer of a particular patient and see these X-rays back. Remember, saving these X-rays is very important, because this software doesn't allows you to move or scan an image for next patient till you have saved the last image of the last patient. Hope you enjoyed this video. See the other video which I have shared on my channel discussing another phosphorus plate system from Kavo called as Scan Exam 1, where I have tried discussing its disadvantages, advantages as well. Thank you. Happy imaging. This radio opacity seen on this X-ray film is the nose ring the patient was wearing, which is a common ornament in my part of the world.